So the higher baseline levels of enzymes these enzymes that you have, it is likely that Fadogia will not work as well. And the lower baseline level of enzymes that you have, and also likely the lower your baseline LH, the more it can potentially help.
Yeah. And next we have, this is another hormone optimization supplement, Fadogia Agrestis. So we've talked about this. We've talked about the data that is there, the data that is not there. So very few studies so far, even in preclinical literature, and still 0 studies in humans on Fadogia Agrestis. But just like rhodiola, it has been used for a long time, not in traditional medicine, but in traditional herbal medicine as an aphrodisiac for fertility and all these sorts of things. And most of the human data out there now is anecdotal, where people are getting some blood work and saying, oh yeah, it increased my luteinizing hormone and my testosterone, or just my luteinizing hormone went up, my testosterone didn't move, or I didn't see anything happen. So looking at the toxicity before, we talked about sort of the dose equivalence, and really if you're taking more than 200 milligrams, that's a potential concern. And we talked about ways to potentially mitigate that. But I had the question the other day that came through, how do I monitor for testicular toxicity? I suppose you could do a semen analysis, but I don't know that there's a lot of people that are going to be doing that. And really, if you are using it on and off, like kind of a cyclical regimen to, I guess, mitigate the risks, then you're not going to be able to see if you're inducing a toxicity. So it's not it's not my first go-to when I'm recommending, like, hey, how do I boost my testosterone? But it can be used, especially if someone wants to take a kitchen sink approach, because people have different risk tolerances. They say, well, I just want to take what is it's studied for a long time, it's shown to be safe, and I don't care if my testosterone only goes up a little bit. It's like, okay. So other people may be like, I want to take everything potentially that could increase my testosterone.
Yes.
And then there's probably a list of 10 things there, and you kind of narrow down the list, and some people are going to still go out and take those 10 things, and they just say, hey, I just want to have my health monitored. So like I said earlier, checking regular blood work is very important whenever you are looking at anything like that. Someone who's using a lot of supplements or starting a new supplement, really they should be getting things checked probably every 3 to 4 months, maybe every 6 months if they've been on things for a long time.
Yes. Also, thank you for calculating the dose equivalency. There's formulas that you use for converting dosing in rodent studies to human studies. And I believe you are the first and only one to actually look at that before making any sort of public statement on Fadogia Agrestis. So thank you for doing that. And again, that's 200 to 300 milligrams. The dose equivalent in the rodent studies did not have toxicity, and that specific toxicity, and again, people can go listen to our Fadogia and Tomcat podcast to hear more about this. Past that, they had elevation in different intracellular enzymes. These enzymes are in their liver, they're also in the testes. 2 of them are called alkaline phosphatase, and you can check this on blood work. And we do on patients that are on Fadogia, especially if a patient happens to be on more than 300 milligrams or more per day. And then also GGT, which is gamma glutamyl transferase. So the higher baseline levels of enzymes these enzymes that you have, it is likely that Fadogia will not work as well. And the lower baseline level of enzymes that you have, and also likely the lower your baseline LH, the more it could potentially help. So it's, in my opinion, it's something that you definitely want to get labs before, during, and after use, and you should keep in mind the benefit and limitations. That being said, we have seen a lot of individuals with relatively low starting LH and even testosterones, and while on Fadogia, their LH has increased significantly. So that's kind of something that we like about it, is there's an effect that at this point, given its historical context and the anecdotal use in traditional medicine, and also what we have seen, it does seem extremely likely that that is a benefit.
Exactly. There are benefits there. There's a compelling case for it. But again, we think that it is a bit in the overrated category just because of the sparse data.
Yep. it seems like every company is coming out with one of these supplements literally just because they heard Huberman and Joe Rogan talk about it. So